So delivery of drugs in a safe and effective manner to patients is a major challenge for treatment of many diseases. When you take a pill, that pill encounters many barriers. It has to bypass digestion in the stomach. It has to be absorbed through the intestine, bypass hepatic clearance, and also has to avoid nonspecific uptake. A potential solution is localized drug delivery. And while this has been applied to millions of patients around the world, continuous release of drugs, which is the main methodology that has been employed, can happen when and where it is not needed. The holy grail of localized drug delivery involves an autonomous system that can release the drug only when it's needed at therapeutically relevant concentrations. So if you consider the case of arthritis as an example, many drugs have been taken off the market, like Vioxx and Bextra, because of their systemic toxicity. However, if you inject those drugs into the joints, they can be quickly cleared through the lymphatic system within minutes or hours. And continuous administration of drugs is not ideal because if the patient goes into remission, you're releasing drugs during that period and depleting the stores for when you need it most. And if in the case of delivery of biologics, if you miss the joint, you're going to be releasing it in a potentially catastrophic location. So there's many conditions where you'd want to have localized drug delivery with minimized systemic effects. You want those drugs to be delivered long-acting, and you want them released only when and where needed most. Certain indications include ulcerative colitis, arthritis, transplantations of organs and tissues, and mucositis. So to address this challenge, we have developed the following platform. This is a self-assembled amphiphile, which is just a small molecule that contains a, whoops. I don't know if there's a laser pointer on this, or, oh, there's one up here? Perfect. So it contains a hydrophobic domain and a hydrophilic domain. So this is water-hating, water-loving, and this is separated by an enzyme cleavable bond. Now we searched the generally recognized as safe list by FDA. This is a list of agents that exist in common consumer goods like toothpaste or cosmetics, and we were able to find amphiphiles that could self-assemble with a particular stimulus into a hydrogel. And this gel, every single molecule in this gel is this amphiphile. And because there's an enzyme cleavable bond, in the presence of inflammation, this will simply disassemble and release whatever is present. And during the assembly process, we can easily entrap both hydrophilic and hydrophobic drugs. Once we have this gel, we can locally administer it potentially anywhere in the body, and when it encounters enzymes that are present during inflammation, it will simply release the drug. We've been able to show that this platform, which is incredibly simple, because we've taken agents from the generally recognized as safe list, they're incredibly cheap and already available on the ton scale. So it's very easy to make in large quantities. We've also shown that we can entrap all kinds of different drugs as shown here and include hydrophobic and hydrophilic molecules. In the case of ulcerative colitis, almost every patient during the course of their disease will require enema therapy, and there's three major problems. One is that the drug, they need to retain the enema for long periods of time. Many patients can't do that. The other is that they need to dose every single day, and so compliance is incredibly low. And then the drug can also be systemically absorbed to encounter toxic effects. And we were able to address all three of those challenges with this platform. So here you can see, after 24 hours of administering this as enema in an ulcerative colitis mouse model, you can see that the gel selectively attaches to the damaged tissue. We've also been able to show that this works with human patient samples for patients who have ulcerative colitis. As you can see here, the inflamed versus the non-inflamed tissue, we get selective attachment. We were also able to change the dosing regimen and dose these animals every other day, whereas if you just dose the drug, it doesn't work. When we switched to the every other day dosing, our hydrogel was able to work. And the reason why is because we selected an amphiphile that was negatively charged, so it could attach to the positively charged ulcers. And once it was attached there, it had selective release at the site of the ulcers, where you have high enzyme concentrations. In the surrounding healthy tissue, where these enzyme levels are much lower, we do not get release and we don't get attachment of this gel to that tissue. We also were able to show that we get on the order of a 5 to 10 times reduction in the systemic toxicity of the drug because it's only being released where it's needed. We've also been exploring the potential of this technology in the area of inflamed skin, so radiation-induced dermatitis. And here you can see the gel selectively attaches to the damaged skin. We've also shown that this gel selectively attaches to mucositis. This is dose-limiting toxicity for head and neck cancer. And here you can see selective attachment of the gel to the areas where we have ulcers, whereas the healthy tissue, we almost have no adhesion. We've also performed a study using a limb transplant model. And so here you can see this is a brown rat hind limb, which has been transplanted onto a white rat. And one of the great challenges with this is that often with organ transplantation, the patients have to take immune suppressive agents every day. And if they feel good, the compliance then can drop off because they stop taking those medications. And so that can be a major issue. And there also can be issues of systemic toxicity for long-time immune suppression. We were able to show that a single time point injection of our gels with immune suppressive agent could maintain the survival of the limbs for over 100 days. In fact, we've taken this up to 150 days. And so single time point injection of the gel with immune suppressant agent lasts for very long times. And then we can keep dosing every 100 days and extend it up to about 300 days. And so you see here, if we just use drug alone, the limb will quickly reject. And in the case of arthritis, we've also been able to show that we can take synovial fluid from arthritic patients and subject at different time points our gel to that fluid, and you can see we get pulses of drug release. Whereas if we take synovial fluid from healthy patients, we see almost no release. So this is demonstrating on-demand responsiveness, and also that the enzyme levels in the arthritic synovial fluid are high enough to promote stimulus-responsive release. And we've also been able to show that these gels have very long-term stability. So here we've taken them out for 120 days, and then when we add enzymes, we end up getting this on-demand release. And in our recent studies towards moving towards a functional model of arthritis, we were able to inject these gels and then show when we pulse inflammation, we get this stimulus-responsive release in vivo. We've applied for multiple patents on this technology, and we believe that we have a blocking position, also freedom to operate. We've also had a chemical engineering company come by and do an assessment, and they think for somewhere on the order of $600,000 that they can develop a process to transfer to a contract manufacturing organization. And the questions that we're addressing in this work is, can we deliver this gel to arthritic joints in animals and extend the duration of effect of a drug? And then also, can we enable disease modification with this technology? Thank you.